Now I'm going to share my screen and we will get started, folks. There we go. To everyone, again, we will go through the roll right as we wrap up today just to make sure that we've accounted for everybody who's here. And again, welcome to our navigation and COVID response meeting. Got lots of things to go over today. So we'll go ahead and get going. Like I said, Babby Budrick from Piedmont Columbus Regional is here. John Duffy from Alabama Institute of Behavioral Health is scheduled to be with us as well. We'll start talking about reopening services, updates, any announcements, upcoming events folks have, and the resources and links, all the information in today's webinar and then or webinar. And, other information. If we could go ahead and mute our phones with the exception of Bambi, please, that'd be great. Thanks. All right, Bambi, we're going to give it a second so we can hopefully get someone muted.
Okay.
All right. I think we're ready to go. So we're going to go ahead and let you get started, Bambi, and I'm going to see if I can figure out how to mute everybody. So go ahead, Bambi, and I'm going to hush.
Okay. Are you ready?
Maybe this is working. I apologize, guys. Just give me a second. I'm desperately trying to see how we can mute folks. If anybody who has any knowledge on how to do that, please let me know.
At the top of my screen, you click participant, and then you click mute all.
Okay. I think that worked.
You'll need to unmute Bambi now.
You should be good to go.
Pat, can you hear me?
Yes, yes.
Okay. Hey, everybody. My name is Bambi Bundrick. I'm the practice manager for 2 offices with Piedmont Columbus Regional. So I manage the Piedmont Columbus Regional Midtown Family Medicine Center, as well as the Piedmont Columbus Regional Community Health Center. Both of the clinics have a separate indigent program, which are both wonderful programs. The Community Health Center in particular is 100% indigent clinic, and so any of the patients who qualify for the program are in this clinic. We have 2 providers and 1 nurse practitioner. They come to the program and all of their family health care needs are handled there. We also in the clinic have specialists who come into the office monthly, sometimes bi-monthly, which we have GI clinic, we have cardiac clinic, podiatry clinic, pulmonary clinic, nephrology clinic, and neurology clinic. And so all of that is included at no cost to the patient. The patients are also qualified for eye screenings at West Georgia Eye Care. They can have all of their services handled inside of the hospital if they needed any studies inside of the hospital. If they go to the ER, they are responsible for their ER bills unless they are admitted. So if they are admitted, their ER bill is paid for. And so that's the ICP program. You must be a resident of Muskogee County to qualify for the program. And I've also given Pat a list of the documents you have to have in order to qualify for the program, and that all goes through the financial screening department. If you live in any of the outside counties, and also Muskogee County, there's also a separate program you can qualify for, which is called our ICT program. And in that clinic, you would be a patient at the Family Medicine Center. And sometimes the patients kind of go back and forth depending on their income at the time. And the screening requirements have gone back and forth between if they have to screen every 3 months or 6 months. So they do have to rescreen to be qualified for the program. But all of their prescriptions are qualified for through the program. And then the ICT program is the same way. They come to the office, everything in the office is covered, everything in the hospital is covered, and the patients they meet a percentage each year, but that all is funded through Piedmont, depending on the patient's annual household income.
Bambi, did you want to go over this financial screening form?
Sure. So this is the financial screening checklist, and this is a little easier than the previous checklist that we had. And I did ask them, Pat, I know you mentioned that it says Homeless Resource Network, and I did mention if it could be simplified to your EMR system versus just Homeless Resource Network, and they're going to check into that. So this is kind of the basis for what you have to bring to your screening appointment. They can ask for more once you get to the screening appointment if there's something that may be a little undetermined, but you're typically approved on site. So they give you an appointment, and your appointment is at the Professional Towers building across, right up beside the hospital. And the appointment does last about an hour, hour and a half. And the appointments are usually a couple weeks out to obtain an appointment, but they're usually very good about getting the patients in and the turnaround time on getting them back in if they did require additional paperwork.
So to be clear, Bambi, you guys are now accepting appointments for financial screenings, and it would be a couple of weeks before the person would get in. Is that about correct?
Yes, they are. They are asking the patients to wear a mask. It is mandatory that any of the offices for Piedmont, you do have to have a mask on. They do ask if you're having any signs or symptoms of COVID if you reschedule. If you have patients who are already on the program and they're having issues getting their wage statements, and I think this goes for new patients patients as well, they are waiving the wage statement and asking, giving them something in lieu of the wage statements if they're not able to obtain that right now.
Okay, great. Does anybody have any questions for Bambi? I'm going to stop sharing the screen for just a minute so that we can take a look and see if anyone has put anything in the chat here. Do you have any questions for Bambi? Okay, so Liz is saying we have a lot of issues with identification not matching where the residence is. And Liz works at the Homeless Resource Network. Maybe the ID says one thing because it's an address they had before. Is that what I'm understanding? I'm going to unmute you for just a second, Liz. And so you're saying the ID may have a previous address or whatever, but they're currently homeless. Is that correct?
Yes, that's part of the problem. And also we have a mailing address and a physical address, and there is a big dispute about that not matching as well.
Bambi, can you address that? Yes, I will bring that to the financial screening office. So we don't necessarily, I'm not actually over the financial screening part of that, but I will clarify, because you guys they should be able to waive that with them being registered with your program.
Okay, thank you for that. If you could get some clarification on that, that would be great.
I sure will. That would be very helpful.
And then the other thing I have, and Antoinette is asking what counties, and this is for residents of Muskogee County only. Bambi,
So
just reiterate.
ICP program, which is the 100% indigent clinic, is only Muskogee County. However, the ICP program can be any county in Georgia.
Okay. Okay, so it's Georgia, we'll say Georgia residents, and we'll let you guys figure out if it's ICP or ICP. Does that sound right?
Right.
Cool. Great. Okay. Any other questions for Bambi before we move on? Okay. I see our other presenter, John, is here. I'm going to bring up my laptop again, and we're going to go on into your program as soon as this. We're trying to move along.
Thank you, everybody.
Thank you, Bambi. The screen is not progressing, so hang on. Let me try and go again here. All right, I think we're up on your side there, John and Dr. Sanchez, and I'm going to let you guys introduce yourself. I'm going to go back and I'm going to mute everybody again, and then I will unmute. John, you should be good to go. Can you hear me?
Yeah, I can hear you. Can you hear us?
Yep, perfect. Go right ahead.
Okay, well, hi, everybody. My name's John Duffy. I'm a clinical mental health counselor in Phoenix City. Previously, I was one of the program directors for Housing First and Balance of State at New Horizons. I'm here with Dr. Sanchez, who is a professional in family children counseling. She's also a licensed professional counselor here at the Alabama Institute for Behavior. Run together. We wanted to, and we're very thankful that you asked us to come on to talk a little bit about homelessness and the family system. Dr. Sanchez is one of our foremost kind of experts on it, and we conduct a lot of research in this area as well. So I would, hand off to Dr. Sanchez if you can see her.
Yeah.
Okay, do I need to click?
Does she need to click anything?
No, you tell me when you want to advance, and we're good to go.
Yeah, just tell her when you want the slide to transfer.
Okay, we can go ahead and transfer.
Are we?
Of course, homelessness is a major issue in the United States. At this time, we probably have more homeless families than any other industrialized nation, and it's increasing. And in the United States, it has increased up to 85%. Not only do I work with John in our facility here, but I'm also a guidance director in a school. And the school that I do work in is populated by a lot of at-risk students, low-income families, and a lot of our population are, not a lot, but many of those students are homeless. And so firsthand, I can see how that just breaks down the family and how it breaks down the academic system and how we even lose children out of the educational process when they are faced with such traumatic situations as being homeless. 1 in 30 children experience homelessness every year, and 51% of those children, sadly, are under the age of 5 years old. Domestic violence is probably one of the major reasons for it. It's usually a precipitating factor in homelessness when you have women and children that are in abusive homes and they have nowhere to go, as well as it being people with mental illness. 88% reported that it contributed to their homelessness. In America, up to 1.6 million youth experience homelessness each year. And the statistics for lesbian, gay, bisexual, and transgender children is even more shocking. This group is up to 40% of most of the people that are experiencing homelessness. And so they have all these other issues on top of not having a home, as far as also being, the prejudice in our community that these young people are faced with and have no place to go. As I mentioned earlier, a few minutes ago, the prevalence of mental illness among people experiencing homelessness in the United States is great. According to the 2015 U.S. Department of Housing and Urban Development Research, 564,708 people were homeless on a given night in the United States. At a minimum, 140,000 or 25% of these people were seriously mentally ill. And I think that we can all think about when we are driving through traffic in Columbus, Phoenix City, pretty much anywhere in the nation, you're always going to see that population of people, especially like when I go to Atlanta, the number of people that are under the bridge, the number of people that are on the side of, the grass of buildings, trying to survive without any type of relation to the community, any type of assistance, or not even knowing where to get it, or people not even knowing necessarily they're there, or what to do, or how to help those people. I was looking at a community in Virginia, and I thought it was really interesting, their continuum of care. I think in a situation such as this, you stakeholders in the community from almost every agency. If you'll see there, they had a street outreach program, and it started with volunteers from different community agencies, of course, United Way, Housing and Urban Development, the Chamber of Commerce. They didn't have that, but I know our Columbus Chamber of Commerce is very active in the community. I worked with them like 20 years ago, just in, I don't know if you've ever heard of the Literate Community Program, where we actually went into low-income homes and tried to help people to be able to read and go back to school and get their, their high school diploma or further their post-secondary education. City officials, the police department, bringing in the police department as a factor to help those that are underprivileged to create that bond and that trust back. The school district, of course, like I was saying earlier, because we deal with a lot of the homeless children. The labor department giving training to people in the community that are homeless, as far as helping them get jobs, helping them to get vocational training. And then healthcare that's very important, physical health and mental health. The community and the continuum of care to be transitional shelters, like I did say, employability and vocational training, rapid rehousing, mental health screenings, and then again, job placement. So that the continuum of care would incorporate all of the different agencies to be able to come together to meet monthly, even, to address different issues and how to reach out to people and how to get the funding and the money to be able to help as many people as possible. So basically, my last little statement that I made, I don't know if you can go back 1 second. Yeah, I'm sorry. We must, I guess the way I feel is that we must assess the needs of our community to understand the issues which first create homeless individuals and families. And that being mental health and domestic and there's other issues. But as a community, I think we must pull together and combine our abilities and resources. I do have a video that I wanted to share, if you can click on, and it kind of puts together that continuum of care of that community in Virginia.
Sure.
I don't know if you can hear it. Do you have your mute on, Pence? Can she hear me?
I don't know.
Hold on, let me try and turn it up. Is that any better?
No, can't hear it.
Okay. Well, let me do this. We are going to send out the presentation to everyone anyway.
Okay.
And that way they could they will hopefully be able to hear it then. And I apologize for that. I didn't realize you were going to have the embedded video.
Oh, that's okay.
Let me get back to, if I can get back to PowerPoint. There we go.
So in regards to our veteran population, I think we should also take into consideration that's basically my specialty here. It's not necessarily in veterans. Most of the PTSD clientele I deal with are women survivors of domestic violence. When we're dealing with PTSD, whether it be from a non-combat or from sexual trauma, there's a tendency towards self-medicating. And so in most cases, we find our post-traumatic stress disorder clientele or patients, I'm more of the medical model than I am the teacher-coach model, so I use the word patient a lot.
Mhm.
But most of our patients in PTSD, with the self-medicating comes addictive habits and behaviors, and of course that exhausts family support resources. And this is the primary contributor to their homelessness is their instability with the self-medicating. So in most cases, working with the VA and things of that nature, as we do, we find that stability in housing is an important part of that, but it's going to be a continuous cycle without treatment. So substance addiction has to be addressed first, or it can be simultaneous. But in my experience so far, and in most of the research that I've written and published with some of the other professionals in the area, is that you've got to stabilize the substance addiction first, and then start dealing with the PTSD symptomatics secondary. Because you're not going to have much focus in the clinical environment if the substance addiction is in the way. You're not going to see any progress with CBT or even focusing on CBT until we've utilized an intervention and gotten them off of the alcohol or drugs. It's almost always a multi-use kind of addiction, so it's not just going to be alcohol or just. At one young lady I was working with, she's 2 years sober now. That's on the 13th. I'm very proud of her. She was using everything but alcohol. And so this polysubstance abuse complicates the issue very much. So, and now we're working very well on the PTSD issues of her sexual trauma and abuse. So that model, I think, is important when we're talking to other clinicians and social workers, is when we're prioritizing treatment, the stabilization at placed, housing, obviously, of course, now Pat knows me from the Housing First days and the balance of state programs, but the housing isn't a necessary part of it. But we can accomplish that with the homelessness issue if we can get them in some type of an inpatient program, which I don't know what those are these days because I've been out for a while. But that detox is important with follow-up and that part, that phase of the IOP, we can actually start addressing the PTSD symptoms. And that model seems to have the most success out here thus far.
So how does someone make an appointment? What are the criteria for engaging with your program? Give us some of those details, if you will, please. John?
Yeah, sure. Okay. So the Alabama Institute for Behavioral Health and Research is actually a private institution. It operates on a lot of grants and contracts. In many cases, how they can make an appointment is simply call us, and then we start the assessment program. We're partnered with at least 2 substance addiction rehab centers, facilities for detox and inpatient treatment, depending on if they have almost the same issue that we kind of have when we're dealing with balance of state or we're dealing with, if we have beds. If we have a bed available, we can get them in there quickly. Otherwise, there's kind of a waiting list. But even if there's a waiting list for inpatient, I will go ahead and start working intensive outpatient. Dr. Sanchez will too, in order to start the motivational interviewing process to keep them motivated and the stages of change that we're looking for to keep them determined and ready to go, so that when it is open, we can get them in there and get them started. So our process for.
I'm sorry. Did you enter is your number on any of the slides that you had? Because if not, I'm going to.
Did you put them on the back? You didn't put them
I
on the
don't think
last.
I did.
I can put out the office number if you'd like.
Okay. Okay, that would be great. That way I can add it when I send it out to everybody.
Yeah. the great slide makers. Yeah. So the phone number here is 334 540 5538, and we also, I do a lot of pro bono work as well. One of the things that I ask them, they don't have to, it's not a condition for receiving treatment here, but I do ask them if they would be willing to participate in certain research that we're doing, because my primary function is clinical, of course, But I publish a lot of research on suicide, suicide trends, contributors to suicide, homelessness in veterans, veterans affairs, and things of that nature, working closely with Troy and Auburn University. And so they kind of, when it comes to case studies, like for instance, the one I was just talking to you about, that kind of allows us to identify new approaches that may be more accustomed to the outliers. I know when you're dealing with statistics, you always have that one or two client that doesn't quite fit the cookie cutter mold that most of our programs kind of require. And so this allows us to start seeing, okay, here are some alternatives we can add to CBT, such as mindfulness. I know that mindfulness is becoming a huge part of an integrated CBT approach out here and among. So things of that nature can be used to, in cases that come in with unusual outliers like polysubstance use, PTSD comorbid with some other like schizophrenia, things of that nature, become very rare cases that we can utilize and share scrubbed information. Not any identifying information, of course, but how did this approach? How was this formulated? What was the outcomes of this approach? The procedures for the approach, and it kind of allows us to contribute to the science and improve models for treatment and assessment, treatment and outcome follow-up. So that was one of the things that I usually will ask is if they would be willing to, sign an informed consent and participate in a study. But that information is always kept very scrubbed.
Gotcha. And one other thing, I know it's the Alabama Institute. Can it be a Georgia resident?
Yes. Okay. You can send Georgia residents over. It's not state specific. That's why we kept it private. We can respond to the broadest community or population as we can possibly do that,
Gotcha.
Without having to be restricted by line item numbers and how it is. Well, you can treat these but not these, and because Georgia's getting a grant over here, then that has to go to this, and so
right.
For us, we seek most of our stuff is DoD related, and there are federal grants that come directly we apply for directly, and we don't have to go through state restrictions.
Okay. And someone's asking, John, if you can name the organization one more time. I know the Alabama Institute, and that's where I get lost.
Oh, yeah, it's a long name. You can blame me. I'm the one that, yeah, she's laughing at me. So it's called the Alabama Institute for Behavioral Health and Research. And so our abilities to combine research allows us to do treatments that are empirically supported, but at the same time identify case studies. And so it's the research money that actually allows us to do joint clinical and research.
Gotcha. Okay. Thank you. Any other questions? If you will, put them into the chat. Every time I try to unmute folks, I start getting feedback again. Well, we're going to give everybody about 15 to 20 seconds to type away if they have any questions. And I will, before we send out the slides, we will add your phone number to contact for appointments, consult, or just a, hey, is this something you got to do? Or, would it be something that needs to be referred somewhere else?
And we do assessments too.
Yeah.
I meant to tell you that we do ADD assessments for children for IEPs if needed, for adults, and we do the MMPI, the Minnesota Multiphasic Personality Inventories, and full assessments. So there's things in that area too. So if you're trying to help, for instance, I help a lot of veterans here who are applying for disability for PTSD or for cognitive dysfunction related to, TBI, traumatic brain injury. When they first put in their disability claim to the Veterans Administration, it's almost always rejected. And then they require new information to reopen it. And so working with Edwin Baez Perez over here in the Alabama VA office in the courthouse in Russell County, they'll come here and I do reassessments for cognitive and for PTSD. And so if I'm able to reach a diagnosis and then Edwin is able to link that to time and service, then we can reopen his claim and help him with his disability.
Well, that's wonderful information. And you can get services, and Liz is asking again, and I just want to reiterate, it does not matter which state you live in,
No.
you got to cross the border.
That's right. Yeah, you can come right across. We're right off the 13. You know where the 13th Street Bridge is. If you're coming from Columbus, Georgia, you'll see the American Legion on the left. I'm a chaplain there, so I'm really proud of our post. And then you go through Main Street intersection, and the very next street you'll see the what is that? Burger King? No,
There's
KFC.
a Wells Fargo. There's KFC.
Yeah,
inside
you see
Wells Fargo.
KFC on the left and Wells Fargo on the right, and 7th Avenue is that very next left turn. And then we're the second building on the right. It's really easy to find us.
Okay. So maybe you.
Yeah. So I think we kind of messed up on the slide here. It's 1211 7th Avenue, and that's in Suite A.
Suite A, okay.
And that's in Phoenix City, Alabama 36867. So we do a lot of work for veterans. So if you have veterans that are trying to do, and we have service officers that we can link them with to help them put their paperwork together for it. So if you have veterans who need that service, we'd be more than happy to help accommodate them for that. I know Edwin is just dying to. I mean, he that's what he does for a living, is getting these people, getting their paperwork together, their packets in, and he'll go ahead and tell you up front they're going to say no. It's almost like an automatic response. Everybody gets denied first, and then we go back into discovering new information or presenting it in a different way. Sometimes it's because they failed to link the diagnosis with, or the trauma leading to the diagnosis, to military service, and so. And we do work with a couple of attorneys here too for U.S. Federal disability, civilian disability as well.
Awesome. All right. Well, it does not look like we have any questions. Thank you again for joining us today. You're more than welcome to hang around for the rest of the meeting.
War Eagle, yeah.
Yeah, we appreciate. All right, Jim. We appreciate you joining us today. And I'm going to go ahead and take care of muting, and we rest of our presentation as soon as I share the screen here. All right. A couple of things that have come up, and Terry, I'm going to attempt to get to where I can unmute you, and not having much luck here. Can you try to unmute yourself? Well, I'll just move along. We have had several instances in the last couple of months, obviously, with everything in a state of flux, and with resources being drained, and access to offices, and or being able to safely serve clients at a time like this. And we thought we were about to open back up, and now we're back in phased closing. So just wanted to go through and see. In fact, I'm going to stop sharing here for a minute so I can unmute folks. Let's have some discussion about how we can ensure that folks are getting referred to where they need to go, and that's probably not going to work. So I will take it. We'll do it in chat then. That way we'll have it. But just we've had folks that have not been able to get referred, and we have a long list of programs not accepting referrals. And I had the list up here, and I have just down the line here. The first one down there being Hope Harbor. Lindsay called me earlier and said she had a conflict and wasn't going to be on, and asked if there was something that we needed from her, and it was about whether they were taking referrals, and her answer was a yes. So that's for emergency shelter, and of course they also have a rapid rehousing program. All of those for victims of domestic violence. Going down the list, and again I can't see the chat while I'm doing this. So I think we have representatives from most of these other agencies. Oh, darn, I hit click too fast. Homeless Resource Network and Open Door. Are you guys able to collect connect. Sexual Assault Center is the center at 909 and has maintained their continuous operations and has their hotline. We will include the chat in the minutes, in the recording and in the slides that we send out so that everyone will see what has happened in the chat room. So if we have a representative from Open Door and or HRN, if you guys can indicate whether or not you guys are able to accept referrals at this time, that would be great. Then next on the list here is New Horizons Shelter Plus Care and Stewart Community Home. Sorry, I can only do two at a time. So if hear from New Horizons, I thought I saw Pam Jones earlier, Shelter Plus Care, and Stewart Community Home. I don't see Kara on here, but I will certainly reach out to her. Open Door is accepting referrals. Thank you so much, Crystal, for that. I don't see Kara from Stewart Community Home here, so I will reach out to her and confirm. So again, it's so all of us can know who's accepting referrals and not. I mean, we know that Homeless Resource Network has maintained continuous operations, don't have any remaining funds for rapid rehousing. Because they've exhausted those funds. Thank you for that, Liz from the Homeless Resource Network. And I know that DCA has not made their funding decision for what is now this funding year, because I think they were delayed in those applications. They delayed that application turn-in deadline. So thank you for that, Liz. And of course, referrals do go through coordinated entry, but it's nice to know for all of us who's accepting referrals and who's not. The VA, yes, we have our new friend from the VA. In fact, I don't want to put you on the spot there. Let me find you, Mr. Warren. The VA, welcome to our new VA rep. And you just started with the VA, or in this area at least, in the past. So welcome to the Columbus, Phoenix City area. So if you want to type in the chat and let us know if the VA is still accepting referrals or has picked up accepting referrals for your inpatient programs, your domiciliary, housing, those kinds of things, that would be fantastic. And Mr. Morgan, I saw you on here for Volunteers of America. And then I saw Melinda also with VIP Emergency Shelter, but if I understand correctly, their VIP was changing their model. If you would just, again, type in the chat and verify that for me, Melinda. I'm sorry?
So I'm gonna type.
Okay. But that way everybody can have it and we'll have it for everybody. But if we can just make sure, that would be great. And please, we all know that there are funding opportunities coming. If any of you are not aware, and I don't believe we added it to the resources for this slide, so we will do that before we send it out. Tomorrow afternoon at 5 o'clock on the Community Reinvestment from the Columbus Consolidated Government on their Facebook page, they are doing a virtual town hall meeting to talk about funding availability through the Community Development Block Grant. If I remember the numbers correctly, it's a little over $900,000 that's been allocated to our community. So they will be talking about that tomorrow. Very, very, very exciting. I'm going to digress for a minute. Mr. Morgan says Volunteers of America continues to accept referrals for both prevention and rapid rehousing. Thank you so much for that, Melvin. I appreciate that. So I'll make sure that everyone gets the link to that meeting. That's going to be interesting information to hear what the priorities are that the city has for the use of that money, and as housing providers, what we can expect to be able to serve the clients, in our community that are at the most vulnerable. So that information will be interesting. There are also some funds coming through Department of Community Affairs that are tentative for our community as well. So hopefully the fact that we've got exhausted funds and that other funding sources have been delayed. Many of those who have, like I said, have DCA money that has been exhausted and then hasn't started yet. So, and those who are waiting on their continuum of care funds, many of those contracts aren't even out yet, so you can't start spending those either. So hopefully we'll have an injection very, very, very soon. With that injection, many of you were on the call last week about the prioritization and planning for our rehousing and how we're going to spend those funds. I'm just going to put a plug out there. If you looked at the spreadsheet during the presentation and haven't looked again, go in there and play with it a little bit. It's really interesting when you start typing things on the first sheet and they start populating on the sheets thereafter and what that looks like. So I've been doing a little of that myself today, and we'll be getting with everyone on what some preliminary thoughts might be on what prioritization is. So please let your voice be heard, and be scheduling that discussion in the next week or so. So I'm going to cheat and go back to see what's the next thing I have to do on our agenda. Making sure, and I guess I just talked about that. How are we helping to make the change in our community for those that we serve? Oh my goodness, I hit the wrong button. So the next thing I want to do is, I'm not going to unmute again because we keep getting some background noise. Okay, let me just go back. I'm reading a couple things in the chat here. You guys may be following along already. VIP is not currently accepting applications. They're changing their model from using church locations for shelter. Thank you for that, Melinda. No, Pam, I did not see anything from I'm sorry, there's Pam Jones. New Horizons is still working extensively, possibly accepting referrals next week. Okay, great. Those already have. Perfect. Thank you so very much for that. And Dr. Sanchez and John sent us the website for the behavioral health, and we will, again, that will be in the chat, and we will go ahead and link it to the resources in our presentation today. And I'm going to try to go back and do this. So obviously I hit the wrong button somewhere. I'm going to need somebody to actually operate this because I'm obviously not doing a really good job. So we've gone on that. Agency updates. Again, any updates that we have, and again, that's why I did not share the screen. So, and actually, Terry, if you can unmute yourself and read if anyone has any updates in the chat box. We just want to make sure that anyone who has an update can have an opportunity. Stopping this again. I apologize for that. We're just making sure that we get every update that anybody has. I don't see anything or anybody giving an update here. Nope, no updates. Okay, and then our next step, we talked about, I guess I talked about that a little bit earlier, talking about how we can make sure we've done, working with the community or the collective reinvestment and rehousing and collective investment or coordinated investment tool, and how we do our planning, how we're talking across our different programs, our different organizations. Are we sharing what our needs are? Are we reaching out to each other and going, hey, I've got this need, how does this work? You know, whether it be I have a client who needs housing and I've run up against a brick wall, and I'm not having luck in securing housing or finding something that's suitable for their family or whatever. How do we reach out to each other? Please make sure that we take the opportunities to use the expertise of each other as we're moving through this. Of course, our next meeting will be August 4th. And, you know, I think we need to just say for the foreseeable future, we will continue to make sure that we do this virtually, because even when we do go back into our phased opening, our phase 2 part of our opening, and start responding or letting small groups into our building, it will be obviously no more than 10 at a time. So we'll be doing that. You've got several resources and links here, and I'm going to attempt one more time here. We're going to see if we can show this so everybody can see some of the we've got here for today. Of course, information from Bambi, Piedmont Indigent Care Program, and Indigent Care Trust. Easy for her to say. Talking about and the screening tool is linked in the presentation, and we'll open up for you so you can sort of have a checklist. Apparently, Waffle House is hiring. Thank you for putting that in there, Terry. I know that they had a downturn. They're now hiring again. We got some information just late yesterday from the Coalition for Supportive Housing on some upcoming webinars, and rather than wait till our weekly announcement, when some of these are this week, we wanted to go ahead and link this here today. And again, we will get these out for you today. Most of them are free. I think there's one or two of them with a cost, but most of them are free webinars. So you may want to attend yourself or pass along to some others who may want to. Free COVID testing this Saturday in Waverly Hall. So pass along to our folks in the northern part of town or our folks in Harris County to get tested. It's a drive-through testing from the Department of Public Health as well. And to all of the slides and the information that was linked in all the slides, the behavioral health. John, it looks like that Terry had already put that in there for you, and the upcoming webinars and things like that. And we will put one more in with information on how to find John's location and phone numbers. So I'm going to stop and just take a look at, we're going to go ahead really quickly and just make sure that we've accounted for everybody who's in attendance. We got a really good crowd here today. Terry, I'm unmuting you. Is there any, I'm just going to run down the list really quickly here. We've got someone who's listed as admin. I'm not sure exactly who that is. So if at the end you don't hear your name, please let us know. We've got Antoinese from Changing Faces Within, Kathy Robinson from Chattahoochee Valley Jail Ministries, Crystal from Open Door, Devlon from HRN, Dr. Sanchez and John from Alabama Institute, Jason from Salvation Army, Jim from Salvation Army, Joshua Norris. Josh, your organization? Okay. All right, Josh, we'll try and pick you back up. I see a note here from Katie. Is there data being on unmet needs? How many families or people are unable to access shelters? Is there a backlog of individuals or families for shelter space? We are collecting some information. We have not. Okay, Liz spoke to 3 women needing shelter on Thursday. And okay, so let's share that information with each other. Mr. Norris is with the subject. That's exactly right. Mr. Norris is with the VA, our other VA friend. Thank you very much, Mr. Warren. Okay, Pastor Mike said Salvation Army Family Shelter is full, but Pathway of taking referrals for services and other business as usual. So if we have females who are looking for shelter, let's see if we can, or any other folks who have unmet needs. Let's and see if we can put out, whether it be an email to us as the the coordinated entry lead or whatever, and not that shelter has to come through coordinated entry, but just sort of so they could be a tracking of that. Thank you for shaking that tree there, Katie, and let's asking those questions because we are collecting what comes in through coordinated entry. We are collecting what comes in through 211. So let's see if we can get more of that information.
Right now, Pat, our huge unmet is housing and shelter for men.
Okay, you saying shelter for men, meaning we have unsheltered needed, or housing programs?
We need housing programs and we need shelters for them.
Okay. Okay, if someone calls 211 and says they're homeless, are they? Yes. If someone calls 211 and is literally homeless, then they do go through the coordinated entry process and are getting referrals to emergency shelter and other services. That is correct. And if there isn't space anywhere, that's where we have to do a better job as coordinators and as case managers from different programs to continue that follow-up process. And that's one of the things that's built into coordinated entry, is to have that continuous contact with clients. But there has to be, they have to come in to talk with, they have to come. So not everyone is going to be captured. You're exactly right. And so making sure that we've all done our due diligence to make sure we do those follow-ups and follow-ups and follow-ups to make sure that needs are being met. And sometimes being that advocate to make sure that we, as soon as something is available, that client gets serviced as quickly as possible. So any other questions, concern? Before we wrap it up. Oh, I'm sorry, I was going through the attendance and I got crossed up. There you go. I was reading and I got crossed up. So Katie with St. Anne is here. Joshua Norris, Terry, I think you got that's VA. Kawana from Salvation Army. Lori, you're put in the chat box, Lori. I just see Lori. I don't know. I've got 2 or 3 Loris. So I'm not sure which Lori this is. Lori from the center at 909. Okay. Thank you. Thank you, Lori. Liz from HRN, Mr. Louis from the COC board, Lydia from HRN, Melinda, of course, from VIP, Mr. Morgan from Volunteers of America, Michelle from HRN, Reverend Mike from Salvation Army, Pam from Shelter Plus Care at New Horizons, Charter from Open Door, Mr. Warren from VA, of course, Terry and Tammy, Tyson Begley from Delta Data Soft, Virginia from New Horizons. Okay, and you have a new website, and again, we'll include the chat in today's minutes, or in the information we share from today's minutes. Actually, I'm going to save it right now so it doesn't get lost. And do this right now so we can have it. If there's anyone, again, that has any other information, just type in the chat. If you need me to unmute you, we are more than willing to do that. Just hate to have all the background when folks are trying to talk about something. So we had a couple of people on the phone. So if you're on the phone, we obviously did not call your name in the roll. We have 1, 2, 3 people on the phone, and I'm going to unmute our phone people really quickly. So phone people, would you mind identifying yourself? We can have you in the record. All righty then. Perhaps I did. Okay, Katie. Okay, thank you, Katie. Katie's on the phone because she couldn't get the audio on her computer. Perfect. Thank you, Katie. All righty. And that may be the case for some of the others, that they could not get the audio. I'm sorry?
Admin.
I'm sorry, I could not understand you.
Admin.
I tried to unmute that person too, and I don't know who that is either, who has not identified themselves. So what we'll do is we'll go ahead and put out the list of those in attendance, and that way you can look. And if your name was not on the list and you were in attendance today, just please let us know. We would like to make sure that we've given everyone the benefit of being here, and we'd like to know who we may need to reach out to next time for to make sure that they join us. We're going to be finishing up here in a few minutes early. I'm going to give everyone about 15 more seconds Thank you, John, for that email address so folks can contact you. We appreciate that. Again, another about 10 seconds just to see if there's anybody who has anything they can say, any updates that they need to express. And if not, I'm going to, you know what, I'm going to go ahead and, since you just put in that email address, John, I want to make sure everybody gets it. I'll go ahead and resave that chat. All right, guys, with that, we are going to call it a day. I'm going to go ahead and stop the recording now, and then we will